PCOS stands for Polycystic Ovary Syndrome, and it affects 8 to 12% of women worldwide. It's the most common endocrine disorder among women of reproductive age. We often find that women with PCOS present to us with difficulty conceiving or irregular menstrual cycles outside of the normal 24 to 35 day window. And that goes back to the diagnosis of PCOS. PCOS has 3 different sets of diagnostic criteria, but the most common is the Reproductive criteria. This requires 2 out of 3 criteria to be met to meet the diagnosis. The first criteria is irregular menstrual cycles outside the 24 to 35 day window. The second criteria is polycystic ovaries seen on transvaginal ultrasound. And the third is clinical or biochemical signs of hyperandrogenism, which just means elevated levels of hormones like testosterone in the blood, or signs of high levels of androgens on physical exams, such as increased hair growth on the upper lip or chin, the lower abdomen or back, male pattern hair loss at the temples, or acne. One thing I think is really important for patients to know is that having menstrual cycles outside of the normal 24 to 35 day window means that you're not ovulating every month, and also means that you may have PCOS. This is important in the short term because it may be more difficult for you to conceive, but also can have long-term health consequences. So it's very important to follow up with your primary care specialist or OBGYN, or consider a consultation with a fertility specialist. Some of the long-term health consequences of PCOS can include increased risk for diabetes, abnormalities of cholesterol and triglycerides, and overgrowth of the lining of the uterus called the endometrium, which in the long term, if untreated, can lead to uterine cancer. It's very important to identify PCOS in women earlier in their lives because we can help them, number one, achieve their family goals. Luckily, for most women with PCOS, it's not that difficult to help them get pregnant once they come and see us, but it can be very difficult to try to conceive on their own. So that's one important thing. And then in terms of long-term health issues, women with PCOS are at higher risk for diabetes and overgrowth of the lining of the uterus, which is called endometrial hyperplasia, which in the very long term can put you at risk for endometrial or uterine cancer. Again, luckily, there are easy treatments that we have that can help reduce those risks. So that's why it is important to see your doctor if you are concerned that you have PCOS so that we can do the appropriate evaluation. A young woman with PCOS who isn't yet ready to start her family, it's very important still to discuss the diagnosis with your OBGYN. And then your OBGYN will put you on a medication to make sure that you have progesterone exposure every month. Because you don't ovulate on your own regularly when you have PCOS, you don't have that progesterone exposure. And so that's what puts you at increased risk of having the lining of the uterus overgrow, and in the long term puts you at increased risk of uterine cancer. So it's a very easy fix. You can use birth control pills, you can use a Mirena IUD, you can use the depot form of progesterone or the implant. So any of them work, and it's just to achieve protection of your lining of the uterus.